Okay, the future of psychedelic therapy as the fifth wave. You can think of technology as coming in generations. Generation 3, Generation 4 for your phone, ChatGPT 3, 4, 5. In the field of therapy, you have waves. So the first wave was behavioral therapy. Then they added cognitive therapy, CBT. Then the third wave is mindfulness, the focus on acceptance. So acceptance and commitment therapy as the third wave. In the previous clip, I argued that psychedelic therapy will represent the fourth wave, that in a few years, psychedelic therapy will be very much commonplace in the field of therapy. And I believe that from that, there will be a fifth and likely final wave of therapy. That wave will be psychedelic therapy with a much, much greater focus on prevention and a focus on community, a focus on connection with your family, your spouse, your tribe, and that this will constitute the real future of therapy, okay? When you think of the medical field, there is an extensive focus on prevention. So imagine, take cancer. If a cancer is very, very rare, the focus will be just on treatment. If you have a very common cancer, like colon cancer, the more common it becomes, the more the focus will shift to also include prevention and screening, right? So that's why you have a lot of people talking about, having high fiber in your diet, right? Quitting smoking to help prevent colon cancer. And there is a greater focus on screening, doing a medical procedure as a prevention, like a colonoscopy. Well, in the field of mental health, I predict that the rates of mental health issues will only increase. There is increasing disconnection. There's a lot of uncertainty. There's a lot of stressors in the world today. Mental health issues will continue to increase, and it's already a pretty bad situation. You can take an auditorium filled with people, have everybody stand up, and say, sit down if you've had a major depressive disorder, or you've had a lot of difficulty getting out of bed, you felt really depressed in the past year. Or sit down if you've had a panic attack. Sit down if you feel really anxious going to a grocery store when it's really crowded. Sit down if you've really felt humiliated and it really stuck with you. Or sit down if you don't really understand dating. You don't understand how to connect with people, how to date well, how to relate. Chances are you wouldn't see many people standing, right? So the question becomes, how come we are waiting for depression, anxiety, trauma to get so bad before starting an intervention, before starting treatment? When it comes to marriage and family therapy, how come couples only really start that when it's either that or divorce, right? When the relationship is now so bad that they're considering splitting. Why is that the time that they then go and they seek treatment? Especially if the rates of divorce and breaking up are so high. The other big trend that we're seeing is that, again, from the fourth wave, that psychedelics appear to be pretty safe and effective. One of the reasons that they promote colonoscopies for colon cancer is because colon cancer is common, but colonoscopies, they're pretty safe, right? And they're actually quite effective. And so relating that to psychedelic therapy, if psychedelic therapy appears to be pretty safe and pretty effective, and mental health issues are ballooning, at what point does it start to make sense to use psychedelic therapy as a form of prevention, prophylactic to the inevitable mental health stressors that occur during adulthood? Now, that is not to say that psychedelics are, they're not without risks. Any substance can be risky, right? There's a story of a guy who was putting caffeine, little scoops, and accidentally got the way wrong scoop, ended up consuming way more caffeine than he should have, and died from it, right? If you don't know what you're doing, and you decided that it's time to drink, and the first bottle you go for is an Everclear, and you just down it, right? You're gonna have a bad time. But when you're knowledgeable about it, when you have someone guiding you, when you have a therapist, you're doing it in the right environment, it turns out that psychedelics are pretty safe and generally quite effective. When I became a father, I was glued to the website SIDScalculator.com because it had some good pointers on how to prevent SIDS, sudden infant death syndrome, and it showed that generally if you do nothing, the general risk of something like that happening of SIDS is about 1 out of 3,000. If you do these various tips, if you have the baby, instead of having the baby sleep on their stomach, have them sleep on their back, you make sure the temperature is controlled, you do a few other things, and that risk goes to 1 out of 12,000, which is much better. So we did these things, and the risk was very, very low. We were very happy. But on that site, they have another statistic, and the statistic just really leapt out. And that is the statistic that 1 out of 35 young adults will attempt suicide to the extent that they will require medical attention between the ages of 15 and 18. That means if you have a decent sized classroom of 35 high schoolers, there's a very good chance that one of them will attempt suicide. And that is a huge problem, and it makes you wonder, how can we put so much effort into doing these things to protect at the beginning of life, and then when they become adults and there's so much stress, you kind of shrug your shoulders and just hope for the best. How come we are waiting until there's a major depressive disorder before focusing on learning or teaching the type of skills that are going to be crucial for managing the depression and anxiety? The idea is that, when you're talking about SIDS, you have to pick a side. You have to pick, do you put the kid on their back? Do you put the kid on their stomach? You have to make a choice. And you use the best research to come up with a conclusion. Well, it may be time to start weighing focusing on certain therapies as protective versus just doing nothing. A good analogy is, think of like going to the gym. It used to be about 100, 150 years ago, most people were farmers. Most people spent most of their day outside doing things, being active. As society progresses, we spend more and more time inside, sitting down. And we now see gyms as a way to compensate, right? To say, look, if you're going to be sitting all day, or you're going to be sitting most of the day, you got to do this sort of artificial intervention. You got to move your body. You have to have a treadmill desk, or you have to spend a few hours each week in a gym doing these things to keep your muscles, right? To keep your health. Now, if you go into a gym and you don't know what you're doing, you have no training, you don't read the machines, you don't work with anybody, there's a good chance you're going to get injured. It's probably not going to be a question of if, but when. But if you go into the gym and you work with somebody and you read the instructions and you follow the trainer's guide, generally speaking, the benefits outweigh the risks. You can think of it as a preventative issue. Well, in our world, especially in the past 20, 30 years, we have become increasingly isolated, right? We have become increasingly fragmented. It's not like yesteryear where you always, lived down the street from your friends and your cousins and your parents. Now we're all kind of spread out. We're increasingly isolated and disconnected, and all the studies show is that it's having a profoundly negative impact on our mental health. So the question becomes, can psychedelics be designed to foster a sense of community? Can we take somebody who is becoming a young adult, go through the sequence, engage in psychedelic therapy, use that process to teach them how to manage stress, how to resolve addictions, how to process trauma, forgive people, reach out to people? Again, when you think of going into the gym, the best time to start going into the gym is not when you are very, very overweight, you're very, very out of shape, you have a heart condition, and now you have to work to lose 60 pounds and get in shape. The best time to start the gym is when you're in decent shape, your early 20s, and you're learning the skills, you're setting the habits of going to the gym, taking care of your body. That is the preventative concept. Well, it's entirely possible the same thing works when it comes to mental health. It's entirely possible that the best time to learn the skills to manage depression and anxiety is when there's a relative level of health, right? It's kind of difficult as a therapist to work with someone who is in a deep throes of depression and tell them that they need to start moving their body and meditate 10 minutes each day, because they're already in a very dark spot. And part of it is just holding space until they come up a little bit, or even using psychiatric medication, and then establishing those healthy pathways. Believe me when I say it is much easier to work with somebody who is happy, healthy, and normal in terms of their mental health, teach them the skills, and that can go a long way towards preventing future big issues. Of course, depression and anxiety are going to come, that's a part of life, but teaching them the skills to better process things and connect with others. So all of this is to say that I predict that the psychedelic therapy will come in, will sort of take over the therapy landscape, and in the future will evolve to focus on community and a focus on prevention. So I feel that in 20 years, it will just as you become an adult and you go to college, it's sort of seen as a process of becoming adult. You may engage in psychedelic therapy with a trainer, a therapist, a guide, teach you the skills, process the traumas of your childhood, forgive the people you need to forgive yourself, learn to connect with others, learn to manage certain feelings, focus on your values as your introduction to adulthood. And so that is what I mean when I talk about the fifth wave. In the next clips, let's go over some of the specifics and what the Pentabelt program is all about. Thank you.